All right.
All right. Well, I would like to thank everyone for joining the School of Public Health Office of Research for our inaugural SPH research seminar series. The purpose of the series will be to highlight research within the School of Public Health and an opportunity for you to hear from your colleagues. So buckle up. Today we have Drs. Maddox, Cash, and Rowe that will be sharing just a drop in the ocean of their research within a newly established Center for Health and Nature between the Texas A&M Health Science Center, Texas by Nature, and Houston Methodist Research Institute. So Dr. Maddox, the stage is yours.
And Dr. Cash actually is leading us off.
Great. Thank you so much, Garrett. So I'll start with an introduction into the history of the center and purpose of the center, and then hand it over to some examples, research projects that will be covered. I believe first Dr. Rowe and then Dr. Maddox today. So just a quick history of the center. We can go to the next slide. I've been involved with Houston Methodist for several years now, going back to 2015 in collaborative research. And the Center for Outcomes Research, which you will see next as context, was established about over a year before we started developing the vision towards a Center for Health and Nature. Right.
Thank you.
It's just somebody unmuted. I thought there was a question already. I was getting excited.
Yeah.
So what happened is Dr. Boom came to us, president of Houston Methodist, and said there is a vision with Texan by Nature, which is the conservation foundation led by former First Lady Laura Bush, to develop a partnership around studying the effect of nature on health outcomes. And it would be amazing to have a university, a conservation foundation, and a health system, a leading academic medical center coming together to develop that vision and launch such a center. So they came to us and wanted us to organize that. And we were able to have a vision statement signed in May of 2018 and celebrated this signing, the birth of this new center as part of the opening of the new towers and the healing design presentations done by the landscape architecture students from Texas A&M at Houston Methodist. So here you see the three leaders of the three organizations coming together, truly excited about developing this vision, signing a vision statement at that point, and then moving forward towards us becoming more official since then. Since then, about 2 months ago, a collaborative agreement, as well as a governance agreement, has been signed between the institutions. So we have become official in terms of a center. Next slide shows you where this, well, that's us. Right now, you see the three partners with Dr. J. Maddox and myself. So in the next slide, then you will see where it sits. So at this point, the center sits within the Center for Outcomes Research. You see the organizational chart for the Center for Outcomes Research, where I serve as the director and report to, on the RI Research Institute side, to Ed Jones and Dirk Sostman, and on the health system side to Dr. Rob Phillips. And then we have our data service center that has been invested in quite a bit in the last couple of years, the collaborative research programs with the centers of excellence that we've been building since 2017. And then under research programs, the more substantive areas, the center right now sits in the research programs. So I think since it's just recently became more established, it will become itself. So we have developed our own organizational chart, become more independent as a center as well. So here's the organizational chart for the Center for Health and Nature with the 2 co-directors. The external advisory board, it's one of those situations where we are blessed with the most engaged advisory board, external advisory board, very engaged in recruitment, growing the center, opportunities, research ideas. So it's a very dynamic group. So on the Methodist side, we have Dr. Robert Jackson and Dr. Rebecca Hall, who are serving. He's a very well-established primary care doctor in Houston area, and Dr. Rebecca Hall is pretty much over strategic partnerships and academic affairs. At Texan by Nature, we have Cynthia Pickett-Stevenson, who sits on the board for Texan by Nature. And truly, Joni, it says Amy. Amy is mostly participating and representing Joni Carswell, who is the president, CEO of Texan by Nature. And then Texas A&M side, we have our own dean, Dr. Sean Gibbs, and the dean of the School of Architecture, Dr. Venegas, their students have been very engaged with us, as well as their faculty. So it made perfect sense for them to also serve on the advisory board on the A&M side. We're organized into 3 committees right now. The symposium is a big deal. So we have a conference committee led by Dr. Maddock. The yearly symposium, I encourage you to participate. You will be getting emails about the symposium you might already have. It's December 8th this year. It will be virtual again, but we're hoping to host next year at Methodist once more. There is a fundraising committee led by Cynthia Pickett-Stevenson. And then there is the research committee led by myself as the chair. We're basically a review committee because the center also makes pilot funding available to collaborative research projects on a bi-yearly basis. So it's a review committee where we have also a partnership with Dr. Greg Brockman at University of Washington in Seattle, where he's also serving with us on that review committee. And then next, there we go. Dr. O. We will go ahead and transition to our wonderful research projects, and we'll have Dr. Rowe present some of the, one of the examples.
Okay, good morning. Oh no, good afternoon. Yes, it's great to see all of you today. And I'm very happy to talk about our ongoing project entitled The Effectiveness of Hydroponic Vegetable Gardening on Improving Quality of Life in Cancer Patients and Their Caregivers. So since diagnosis, so cancer patients experience high mental distress across the cancer trajectory. So many factors affect the development of psychological distress among cancer patients. So the next slide, please. Yeah, and the recent study shows even the significantly higher prevalence and severity of anxiety and depression in cancer patients compared to healthy controls. And their mental health is highly related to their pain perception and quality of life as well. Then what about the family caregivers? So actually they spend excessive hours, more than 40 hours per week in caregiving, and half of them actually have a serious psychological issues. And this also leads to even higher risk of physiological diseases. So therefore, it is important to develop intervention strategies to reduce this psychological stress and improve the quality of life in both cancer patients and their caregivers. So regular contact with nature can promote health. So gardening is a great method to make contact with nature. So gardening provides substantial health benefits, so including reduction in depression and even pain medication use, and also increased self-esteem and mood. So especially, vegetable gardening increases the consumption of healthier diets. And another important thing is, it makes patients experience hopeful and nurturing feelings and a sense of achievement, because they will harvest their products and they will eat by themselves, and they can also feed their family members. However, there are some challenges with this traditional gardening. So at first, it is difficult to do it in an urban setting without yards. And another issue is that it is also climate and weather dependent. So if you think about this scorching summer and freezing winter, so even in Texas, in the middle of summer, actually almost nothing grows. So it also has risks from surrounding variables such as weeds and insects. And also the last one, there's also the accessibility issue, especially in the people in wheelchair or the elderly people who cannot kneel or bend easily. So some suggested the healing garden or community garden, but as you know, it may not be available in many areas. So also one important thing is, so those activities can be restricted under certain situations, such as COVID-19 pandemic requiring social distance. So the indoor hydroponic gardening system is a solution for these challenges. So this is soilless, and the soluble nutrients are provided directly to the roots in the water. And it is not affected by those geological conditions or other surrounding variables such as weeds or insects, and leading to no toxic chemical use. So, and also it is easily accommodated and provides accessible gardening experience to all kinds of people. So the size of this system we use is small, and a little indoor area, even at the corner of the table, is enough. So there are actually, okay, the next. Yeah, so what we are using is this small one, but there are also actually a variety of different types of hydroponic systems in the market. So this is the first study to examine the feasibility of the indoor hydroponic vegetable gardening system as an intervention strategy to improve mental health and quality of life in cancer patients and their caregivers. So we will conduct the intervention study with 25 pairs of cancer patients and caregivers, so totally 50, so recruited at the Houston Methodist Cancer Center. So they will grow vegetables at home for 12 weeks with this hydroponic system. So the outcomes will be evaluated at baseline in 6 weeks and 12 weeks. So depression and quality of life so mental well-being and depression and quality of life and fruit and vegetable intake and pain management will be assessed using surveys. And the serum cortisol will be measured in the blood so which is a biomarker for stress. And the last open-ended questionnaire will be used to assess their experience and to express their feelings. So this study will provide evidence whether this indoor hydroponic gardening system can be integrated with cancer treatment to manage mental health and quality of life. So in addition, so our findings can also promote daily contact with nature in general people, so who could not participate in conventional gardening. So actually, we are also planning to expand this intervention study to other chronic disease patients or non-patient elderly people and even students. So we established a multidisciplinary research team. So as you can see here, so we have our collaborators at Houston Methodist Cancer Center, and also Dr. Charlie Hall is at Agriculture and Life Sciences on campus. Thank you for your attention.
All right. Thank you both. And I'm going to do a little bit of a broader look into health and nature and some of the other research that we're doing as part of the center. So why is the center important? Why would we create an entire center for health and nature? Well, this is one of the issues, is the time that we've spent in electronic or digital devices has exploded in the last few years. Between 2012 and 2018, about 30 minutes a day of additional time spent in front of screens. The estimates actually out for 2020 and 2021 are over 13 hours. We saw an additional hour a day during the pandemic as people were home and they were stuck in front of their TVs or binging Netflix, etc. At the same time, we've seen this rapid urbanization of America. We went from, at the turn of the century, only about 40% of the population living in cities to over 80%. What's interesting is actually the rural population is pretty much the same in 1900 as it is today. Almost all of the growth in America has been in urban populations. And what's that done was really removed Americans and people throughout the world from nature. And so you can look on this graph, and that 56% of American adults report getting less than 5 hours a week outside. Really limited time. That's only about 40 minutes a day. So we spend all of our time indoors, which has a variety of negative effects on our health. And so kind of the basis that we look at in this field is called the Biophilia Hypothesis, which is from E.O. Wilson, and it's the innate emotional affiliation of human beings to other living organisms. And the idea is that we should be connected to nature, and when we're not connected to nature, bad things happen. And this to me is like, I think my favorite study to say, if you had to show one study on nature, this is the one. They found that high residential exposure to green spaces is associated with an 8% lower risk of all-cause mortality. So if you're in a neighborhood with green space, you're 8% less likely to die. That's about as straightforward as you can get with one study. But then it gets us into these questions on what is nature? And you can look at both of these pictures, right? With a, looks like one from my old hometown in Hawaii, where we had beautiful waterfalls and the like, and to a green parking lot. And we know those are different, but would you classify or consider both of those as nature? And so we start looking at questions like this, where we start to get the spectrum of nature contact through large scale things that we might do occasional, to routine and ongoing on a smaller scale, and trying to figure out what dose of nature do people actually need to improve their health. And this is important, because it's not something like smoking, where it's a yes no. It really is a gradient, and seems to help the more that you get. The other thing that's interesting is what senses of nature are important. We know being in the middle of a forest is good for you, but can we put a picture of nature? Can we give you a window? Can we do the smell of evergreens? How does each of those affect? And so one of the pilot studies that the center funded looked at the effect of visual reality in oncology patients. So these were patients coming in for chemotherapy, and they either received a VR headset, or they got the normal room without it. It was crossover design. And they found that people really took well to the VR and reported less pain, and actually said it was enjoyable, which is, if you can get somebody coming into chemotherapy with the word enjoyable when they leave, you've done something pretty amazing. And so that's one of our studies. You can see some of the partnerships here, including Dr. Zhu from our epidemiology department. And this work is interesting. It actually, Roger Ehrlich, who was over in College of Architecture and the head of the Center for Health Systems and Design, which still exists today, and I'm on the board for, did some of the pioneering work back in 1984. And he found that hospital patients who just had a view of nature through their window recovered faster, spent less time in the hospital, had less painkillers, and less post-op complications. This research has really been pretty vibrant, as hospitals being the first place that a lot of things are looked at. Just having daylight in the room, natural daylight, less pain, less stress, pain medications. Gardens seem to really make a difference. We saw Dr. Rowe's example of home gardening, but certainly healing gardens where people are in the hospital can help also. And the way that we design our healthcare facilities really has a strong effect on people's health. This study is kind of a landmark study, just came out 2 years ago, study in the UK looking at time that people actually spent visiting natural environments. So this is a little bit more of a rigorous one than that time outside. You actually had to go, you couldn't take your backyard, you had to go to a park or to go to a forest. And they found that 2 hours a week seemed to be the jumping point where you saw increases in both physical and mental health. So we see that as kind of the baseline for traveling out and seeing green space. But again, it's this definition. Your backyard didn't count in the study. So we're always trying to better quantify what the real dosage of nature should be for improved health. This paper came out a couple of years ago. See, almost everything is new in this field, but it really looked at why we know that spending time in nature is related to better health, but what is it that's making the difference? And they split it into these three buckets: reducing harm and mitigation, restoring capacities, and building capacities. So I'll take a look at each of these in turn. So reducing harm, increasing green space in urban areas has a direct effect on improving health. Green space typically have lower air pollution levels than urban areas, may help remove harmful particles from the air. Urban green space can also reduce heat island effect, making cities cooler and increasing airspeed, which certainly in Texas is a good thing. It also reduces noise level by 5 to 10 decibels. And green infrastructure can help reduce flooding during hurricanes and other storm events. So we all remember Hurricane Harvey well. The center is actively working now with the city of Houston on a green infrastructure project looking at bioswales and really the way that we can plant green spaces and reduce flood damage in the city of Houston. So important work that I think is really making a difference. Again, at the city level, this is an article that's published in the New York Times just August of this year. And couldn't have said it better than I could have. To measure inequality, map the trees in the city. And you can really look across urban areas and find out that lower income areas have less green space. And it's, it becomes a social justice issue because temperature makes a difference. And so this is a study that was published in not known for being steamy Toronto, but it looked at the number of calls to 911 during a heat wave. And you can see the places with low canopy coverage got a lot more calls. Now that is obviously possibly mixed with poverty. Toronto is a city that a lot of people do not have air conditioning because it doesn't typically get hot. But you can see that there's definitely this high level of heat exhaustion in areas with low tree cover. So those are kind of the big effects of kind of the natural environment directly on kind of heat and flooding, et cetera. Moving to restoring capacities, nature reduces stress and improves attention. It may reset our attention ability. So they've looked at studies with office workers and students who spent time in natural environments, and the exposure showed an increase in time on task and attention to detail, as well as improved cognitive function. So my doctoral student, Sarah Yu, is just been working through RB right now, but we'll be running a study with the Marco Palma and the Human Behavior Lab, actually testing this out with exposure to nature and both on sight and smell to see if we can get reduce stress and improve sharing and reduce stealing or theft during the study. Improvements in creative tasks have also been seen. So a couple of these are a little bit older, but urban dwellers brought to a natural environment for a couple of days, less mental fatigue, less irritability and accidents, increased problem solving, increased concentration. This is a research design of an intention restoration study. So what they do with school kids is they have them go out, they test them, either do recess in free play or recess, in the gym, and then take them again and look at their perceived restoration, their ability to attention to task, and they do a lot better. So I've been telling my students, if you're doing finals and you got finals back to back, go and walk across to the gardens and spend your time between classes there. It can make a big difference. And one thing on our list is actually test out that outdoor classroom to see if we get better attention, better scores on exams if students are exposed to nature in the classroom environment. And the third area is building capacities. Not only can nature restore us, but it can also promote health by encouraging physical activity, improving relationships in communities. Certain types of green space, including parks, hiking, walking trails, green schoolyards, have been found to increase physical activity and potentially increase benefits. Access to green space can increase social cohesion, a measure of neighbors knowing and trusting each other. And so these are studies looking at physical activity in outdoor versus indoor environments. And they found there was a lower risk, an odds ratio of 0.55 of poor mental health for people that exercise in nature versus in gyms. So again, attention improving abilities. In my journal of Healthy Eating and Active Living, a review of exercise in nature was just published in our last issue. For anybody that wants to see it, there's about 40 studies now that have been done in this area. These green space playgrounds with children are getting a lot of attention now, where you're actually trying to bring nature in, increase vigorous physical activity, decreasing sedentary time, and fewer fights. And I think, as parents, I can say that's definitely nice to have fewer fights and things you have to break up. And if we can bring nature in, that's fantastic. The study I did with Myron Floyd up at NC State a few years ago, we looked at leisure time physical activity in parks in diverse communities. So we went to predominantly African-American, Hispanic, and white neighborhoods, both high and low income, in Chicago and in Tampa. And this was a physical activity study. So we measured physical activity. This is a Chicago park that we went to, and this is a Tampa park. And you can see they're constructed differently. And we found that 70% of people were sedentary in Tampa compared to 51% in Chicago. What's interesting is I ran this looking at physical activity, and this is 10, 15 years ago now. And then we went to China, and we ran the same study in a city called Nanchang, which is about the same size as Chicago, that you've never heard of. Of course, I said that about Wuhan every year until 2 years ago. We found 75,000 people in the parks in Nanchang, about the same amount of parks, same amount of population, compared to only 5,000 people in Chicago. So massive differences of usage in parks in connection to nature among urban dwellers in Nanchang and Chicago. What's interesting is more than half of the park users in China were older adults, compared to less than 10% in the US. And you can look at that picture of a Chinese park. The construction is obviously dramatically different than parks that we build in the US, which tend to be built for children and teenagers. This is one of my favorite studies, the study in Japan, where they took people out for forest bathing, which is going and spending time in nature and really going through all your senses. It's kind of a mindfulness meditation. They took natural killer cells and they measured them before they did 3 days, 2 nights in the forest or in the city. And nothing happened in the city, but what's cool about this is huge jump in natural killer cells in the first 2 days. Day 7 is still there, still significantly higher 30 days later. So a weekend in nature once a month can increase your overall levels of natural killer cells, immunoresponse. So amazing what nature can do. And we're still trying to find out what the active modality or pathway is for that, but definitely the evidence is there. Bida and I have been working with the Houston Parks Board over the last year, looking at their Bayou Greenways approach. So this is 150 miles of trail, linear trail, 3,000 acres of green space, this $220 million public-private partnership throughout the city of Houston. As they add in green space, we did a retrospective study looking at hospitalizations in the inpatient data, and we found significant reductions in hospitalization for several different health conditions. And so it seems like there is really in the communities that had access, a change in health status. So what we're working on trying to get funded right now is a study to use those observational methods that I used in Chicago and Tampa and China to do that, as the trail now has been extended through several low-income communities. to make sure that the people using the trails are actually coming from the community, and it's not just wealthy people that cut through, but actually that we are addressing health disparities through the Bayou Greenway project. There's a variety of preventative effects that have been seen throughout the world. Actually, the US is probably the farthest behind in this. So forest bathing, as I mentioned before, is huge in Japan. Scotland, now doctors can give out nature prescriptions and get paid for them as part of their job, their salary. UK has started a 30-day wild program to encourage people to spend time outside. You see the picture there, the kit that gets families and kids involved in that. ParkRx America, it does prescriptions for patients. So we're planning grand rounds with both Methodist and Village Cotton White in the spring to do teach physicians how to prescribe nature and get them prescription pads. That's another one we're working on. So my most recent work, we've been looking at behavior change and health promotion using social cognitive theory. We were taking a lot of this is we need some individual-based interventions to change people's knowledge, attitudes, beliefs, etc., self-efficacy. And so we've done a nationwide study over the past year, 9-step study with a huge group of investigators. We have the data. I submitted the first paper yesterday on self-efficacy and intentions that look fantastic, really going through every layer of high quality psychosocial measurement development. So we'll have these scales, and we'll be the center that develop these for anybody that uses social cognitive model and health and nature in the future. So that's pretty cool. This is my list of investigators from that team, and you can see they really are across the country. You've got people here at A&M, we've got folks from Tulane and Northwestern and University of Washington, et cetera. So it really is a nationwide effort on this. And we did receive a gift from the Merrick family that helped support this work. And the Physical Activity Policy Research Network Parks and Green Space Group has been involved also. So that's all my slides. Thank you, everybody. I think we have some time for questions.
I know you had mentioned on one of the slides about recess. Oh, someone has their hands up. Alan Garcia Martinez.
Hi, yes, I do have a question in regards of how just interacting with nature per se improves health overall. And I'm working on a policy that it's promoting active living to combat obesity. So I just wanted to ask in regards to that, because the policy I'm reviewing is called Safe Roads to School. And in that scope, I'm looking to not only see the policy as improving the roads for the kids, but also maybe improving the infrastructure that comes around it, and also in that aspect put maybe some parks, because you define like, well, this is nature, but this is also nature. So I just want to see what's your opinion on that, or what insight you can give me in regards of my policy with what you've seen that nature improves health.
Yeah, Alan, that's a great question, because I've worked on Safe Routes to School for probably a decade now. We did a lot of work in Hawaii on that. And it's interesting because I think nature was typically not something that we considered along doing that, but I think it makes a lot of sense. And I think one thing that we did was we put out planters, just to extend curb cuts and the like. And so when people where kids are walking to school, one of the dangers is cars coming really close to the sidewalk, right? And so we put up these, massive planters with flowers and everything in them. And that provided a buffer, but it also integrates nature into the walking environment. And that's, a lot of the places Safe Routes get put in are dense urban environments. And so if there are ways to green when you're doing that, I think that you'll get a double health benefit for that.
Thank you so much. I appreciate it. So you're saying that not on just by putting something as like a tree, flowers, it will highly improve not only like the health of children, but also whoever is walking on that road. Okay.
Yeah, so you're gonna, I mean, you'll get the benefit of the tree from air pollution, noise reduction, but you'll also get kind of the mood enhancement of greenery.
Sam had asked if outside of work, work with recess and children, if there were any other ways that y'all might be addressing nature deficient disorders.
In children specifically?
Mm-hmm.
So we actually, there is a Children in Nature network that Sarah Coles runs for the state of Texas. And so we are a partner of that network. Selena Stasi has been working with a group out of Houston that actually is getting inner city kids out to parks. So that's kind of been the major foothold there. But it was since there's been such a strong kids network, we've mostly been focused on adults in our work, just because there was nobody doing the adult side of it.
Hi, I have a question. It's here. So you mentioned COVID and how COVID affected people because of being indoors. So do you have the opposite of that? And I'm just talking about that from my personal perspective. I was more in contact with nature before, or I was going out to walk more because I was in the house and I was just walking around, and it's a nice neighborhood and all that. So do you have something on that opposite side, or to implement, I don't know, one day working from home because you have access to those?
Yeah, it's, that's a great question. We've been working, we put in a center grant for remote workers earlier this year, and one of the components was nature. And we have a survey that we're getting close to fielding, actually looking at what is the access to nature among remote workers. And we think it's unfortunately going to be very uneven, right? So it's something that I think is going to magnify health disparities, because higher income workers tend to have more access to nature. Now they're spending more time at home, and people that are in a small apartment in an inner city area next to a highway, you're actually magnifying the negative aspect. Where I can control nature in an office space, I can't at home. So it's very interesting. And I think in your experience, saying I spent more time outside during COVID is definitely true. And what we're trying to look at is how do we keep that from reverting? As people start going back to the office, we don't want them to lose their connection with nature. And so, yeah, it's a very interesting time for this type of research.
Yes. Yeah, that's really interesting. And then another thing is public land, for example, in states where public land, it's more, the percentage of public land is higher. I wonder if that also makes a big difference. Like, this is not just the everyday, but going on a long weekend or just during the weekend to have access to nice forests, national parks, something like that.
Yeah, we've been looking. Colorado is the healthiest state in the country, and there's got so much public land in Colorado. We're actually working right now with the head of state parks for Texas, who's an Aggie, which is pretty cool, to develop a program with AgriLife Extension to increase access and visits to state parks. Okay. And so we have 89 great state parks in the state, but a lot of people don't know about them.
Yeah, that's true. Thanks.
Dr. Perez had mentioned me a question. So was the consensus that backyard nature contact doesn't help?
No, so everybody defines everything in a different way. I always use any type of time in green space, but this is a part of the definitional piece. So the UK didn't include backyard. Now remember, the US is more suburban than the UK. And so a lot of people have more backyard nature, but any nature, any time in green space is good for you. It's the quantifying and measurement piece that makes it tougher.
This question, this is Beta speaking, this question of what's nature and what counts as nature does come up quite a bit. One of our early contributions to this field is actually looking at validating nature images. It's more on the research side. So the images we have validated as nature images versus not nature images. is for the purpose of using these images in an fMRI study, for example. But it gets us a little bit closer to what we think nature should look like, right? So that publication and the images are available on our website if you're at all interested in this area of research.
A follow-up question was, do you think that hydroponic gardens would be beneficial for non-cancer patients as well? So just in general.
Yeah, so I think so. Yes, as I mentioned, this is another form of contact with nature. So as I mentioned, in terms of, so the general the contact with nature, like promote health, right? So for example, including gardening. But as I mentioned, but the problem is, even for example in Texas, we cannot have those experience in a hot summer. And even if we think about the east side of Midwest, they have really harsh winter. It is also in the same way. So we using this hydroponic system, then people have this experience year round, and without those even without those geological conditions or other affected by surrounding variables.
If you don't mind, I'd like to follow up with the question, or maybe even a follow-on study that might be interesting. I know, so the personal example that I've seen, my stepmother had shoulder and hand surgery recently. And so she'd been doing some outdoor gardening, and all of those psychosocial aspects that you'd mentioned about the sense of accomplishment and all of that, which I saw, but I hadn't really reflected on. You know, she was, yeah, so annoying. I thought, oh, that's true. She'd really benefited from that, and then wasn't able to do it because of, you know, her surgery. And, but then as I'm remembering now, when I was working in a head injury rehab facility, that they had horticulture therapy for those patients for cognitive rehab and all of that. And I wonder if the benefits of this for, you know, people going through occupational therapy, if they can do the horticulture therapy or a horticulture gardening, which can be more contained. You don't have to be outside. You don't have to, it's more controlled. That might be an interesting way of looking at it, you know, as this, it's contact with nature as much as it is the step piece of it, that this, you know, all of the things that you all are looking at. I think that's really cool. It's a fascinating piece of it. I think I know what I'm going to get my stepmother for Christmas now, actually. So.
Did anyone else have any other questions for our presenters?
I just shared, or Garrett shared, the publication on the images, the validation study.
So if nobody else has another question, I do. So I was thinking, as some of you know, my work is in industrial settings, and, you know, looking at making that work safer and improving safety climate is one of them. And has there been any work done looking at improving the amount of exposure to nature in those sort of situations? Maybe, you know, when you're talking about these chemical plants or refineries or things like that, I mean, they could put trees in there. Trees will live in there. They can have gardens. I mean, has there been any work done with regard to the impact of that with, I don't know, just the workers' attitudes or anything?
I don't think so. I think everything I've read has been office workers. But if you can find a company that wants to do it, I'm working with a foundation out of Houston that gives away free trees. And so we could do it and test it, because I think that'd be interesting.
And if nobody wants to add anything, I think looking at air pollution at the same time, indoor air pollution will be really interesting because there are some plants that absorb some chemicals and all that. So that might be something that will be interesting.
Yeah, we just bought a bunch of air monitors that Natalie has, so.
Yeah.
Well, I'll reach out to my colleagues with the consortium and we'll see. That could be
Yeah, I mean, it'll be just even just a pilot study to look at just worker attitudes and norms and that kind of stuff would be, because that's no one's done heavy industry.
Yeah. On the health system side, most of our studies were looking at effects on both patients and the healthcare workers. So we're getting more and more data on that. And also the effect of incorporating nature into the workplace on the hospital side, obviously, on healthcare worker burnout or fatigue.
Alan, I see your hands up.
Yeah, and again, I'm sorry for asking so many questions. I'm a grad student for it's called Public Health for Policy Management. So this is very helpful for my research. And the thing is that the problem at hand is, or the problem we're trying to solve through the course is obesity. And a lot of it is like they're trying to tackle with taxes on sugary beverage, SSBs. But I was put in the category of physical activity. So I wanted to ask you, besides using nature, what other social ecological strategies you think could help my cause towards like tackling the topic of obesity? Because I think it was really interesting that you talk nature helps with health, but when the problem is already there, like obesity, what else do you think it might help with the understanding of social ecological area, Dr. Maddock?
That's a big question. We got entire book chapters and books written on that, but stuff that we looked at in terms of policy change were subsidizing bus passes for folks, because you're getting people that were driving everywhere, and so we made busing cheaper. We looked at and we did some of the programs, so not only is safer routes to school, but walking school buses, where one parent goes and picks up all the kids along the way. That also increased walking. We did active evidence-based physical education, which gets kids a lot more active. Spark and Catch or different programs for that. We did a lot of urban land use design, so walkable communities, mixed use, that sort of thing that encourage walking, because you can park once and walk everywhere. I can send you some resources. If you just shoot me an email, I can send you some stuff, because it's an entire field, right?
No, thank you. And the reason why I'm asking is because, obesity is such a topic that it's like, it's due to lack of exercise and the way you eat. So I do want to make, since I was assigned physical activity,
Yeah.
I do want to say, hey, this is like 50%. Some people say there's 20%, 80% is what you eat. So I do want to create that statement, like physical activity is more important than what other people think.
I would say that what we've seen in the data is that physical activity is very important for preventing weight gain. There's less evidence that shows that physical activity is important for weight loss. It is more diet it's interesting because, if you're out of weight, you can kind of maintain, but it's hard to exercise your way out of obesity. It really has to be, it probably is a 75 to 80% diet for weight loss.
So I also want to add just one thing. So as you talked about the effectiveness of this contact with nature on obesity. So so one is like it can actually increase the physical activity. And another one is, as I already mentioned in my presentation, so actually there is studies that showing that this, for example, like vegetable gardening actually increased the consumption of healthier diet, so rich in fruits and vegetables. So you can also maybe consider this size when you consider your research.
Oh, thank you. I would love to. I think that we were limited we were divided into categories, and I was just put into physical activity. I also really like your presentation. I think it's very important. It's like hand in hand. I did not know that is just exercise is more to maintaining and eating is for dropping. So that's definitely a point I'm gonna make for my presentation for sure. But thank you. I really liked both of your presentations were great. I got really excited.
Good.
Faraz had a question for Dr. Rowe.
Thank you. My question was in regards to the costs for the hydroponic kits. From my understanding, they are quite expensive, and I understand this is like a pilot study. But in terms of thinking about future sustainability and taking into consideration that mental health and depression does affect the lower social economic status people proportionally. Has that been taken into consideration, like moving forward?
Actually, these days, so when I first started thinking about this project, even kind of a year ago, there were not that many brands. But these days, if you check even Amazon, they have a variety of options. So for example, what we are using right now is, so at this point, I think the price is around $140 something. Yeah, so also when you buy these 6 pods, then it might be around $7-8, I think. Yeah, so this one we are using is a little expensive, like $140 something. But if you check the Amazon and other things, you can still find something cheaper. So I think when if it is more kind of more popular, getting popular, I think definitely the price will go down. Yeah, but as you mentioned at this time, so that's why we do this intervention study first to see the effectiveness of this one. But yeah, as you mentioned, so if we actually try to encourage people in low socioeconomic status, yeah, as you mentioned, it might be a little burden at this moment.
So in terms of cost, maybe also considering the other 2 studies that are also funded through the Center for Health and Nature with collaborators at A&M, look at the virtual reality options. So one is virtual reality for chemo patients that Dr. Maddock mentioned. And then yet another one is a virtual window for hospitals that, hospital rooms that don't have a window, where you're looking out into a virtual window that gives you even a sense of day and night passing, so daylight and night. So those are some options that we're looking at.
And also, although this system is around $140 something, so but once you get it, so after that point, they only need to buy this seed pod. So I think in terms of that, it might be not that much burden as well at the same time.
Alan, you have your hand raised.
Yeah, this is just for my own interest, but Dr. Rowe, in regards of eating habits of the regular American, that I've seen that there's a lot of meat consumption, and meat consumption has been directly related to cancer, cancer and other health problems. Would you say that your solution is not only cheaper, but also like more friendly with the environment and also with the possible future dietary options for a regular American? Because I think a lot of people think it's too costly, but then when you look at the farming practices and the ranching and everything, it might be a better option, but I'm not really sure compared to the research you're going through. So I just want to ask you that, like, how feasible is it that is more economically accessible, and also how would that impact the regular American with the consumption of meat? Like, would it be more affordable? Would it be actually healthier for them? How do you convince an American to, hey, don't try that meat, try this tasty vegetable? I hope it makes sense, the question.
I think that is also really a great point we can discuss, but definitely I don't have the direct answer for that. So at this moment, so we are, as I mentioned, the one thing is it is the regular farming has the impact on the based on those, for example, climate, for example. So one thing is, so I also have a friend in Alaska, and in her case, she is actually growing. So even when you saw the recent Alaska now, it already snowed and very cold, and for them, in those cases, it's also expensive to buy the fresh vegetable during that time period. So in that case, so they are actually growing this salad greens, and they also actually consume it almost every day. Yeah, but in terms of that, you mentioned about this meat industry and many other factors. So definitely, we need kind of more broad discussion about that and evaluate the impact of each components.
All right, well, I see it's 1 o'clock already, so I would like to thank everybody for your all's attendance. We will be resuming these actually in February. We'll have the Center for Community and Health Development. But to our friends with the Health and Nature, and on the second floor with myself, and also third floor, just want to say thank y'all for y'all's time, and hope everyone has a phenomenal holiday season coming up.